The numbers from the Centers for Disease Control and Prevention are staggering. 12.3 million American adults say they have considered suicide. And when it comes to the Black community and Black men specifically, the statistics are even more troubling. Between 2011 and 2020, the suicide rate among Black men was 3 times that of Black women. Dr. Richard Doss, a clinical psychologist and author of the book Good Soldiers Suffer in Silence, PTSD, Suicide, and Other Stuff Soldiers Don't Talk About, joins us today to talk about the urgent need for change in the way mental health is addressed among Black men. Dr. Doss, thank you so much for joining us. It's great to have you here.
Thank you for having me.
Yeah, and so first of all, I just want to say this is a subject that is near and dear to my heart. I lost my father to suicide in 2007, and so I just thank you and the many people who have made this their mission, to try to reverse what's going on and try to impact and save lives. Yeah, so, talk about just, as I just read, the statistics are going up and up when it comes to Black men contemplating and taking their lives. Why is that happening?
Wow, so from 1991 to 2017, there's been a 73% increase in suicides among Black adolescents. And actually it's not 3, it's 4 times more that Black men are suiciding than Black women. Now here's the tricky thing. Black women think about suicide more, but men are more effective at completing it because the means by which they're using is much more lethal, and it's usually firearms. And so you ask the question, why are Black men suiciding? At the end of the day, anybody suicides because they feel like they're out of options. They've done everything that they know to do, and they're at their wits' end. Now the challenge is, as a Black man, there are societal and cultural norms that tell us that we can't show weakness, we can't show vulnerability, that we have to be tough, we have to be strong, we have to be resilient and self-reliant. So at the end of the day, if I'm the strong one, I'm the one that's keeping you safe, the question becomes, who do I turn to? When you think about the stigma associated with mental health, who am I going to turn to if in my society, in my culture, people have been taught to believe that if I have a mental health issue or a mental illness, then I must keep it to yourself.
Right.
I hear people say all the time that I might have problems, but I'm not crazy. And so the question, becomes, do I have to be crazy to have mental health issues? For Black men, where do you turn? If I live in Inglewood, where do I go for mental health care? The truth is, so I did my residency, which is like an internship at Cook County Hospital. So my last year of my doctoral program. Here's what I learned, that most Black men don't have a physician, right? They are receiving their medical care in the emergency room. So if I don't have a primary care physician, the question then becomes, who am I going to for mental health care? Right,
so that preventive health is not being addressed, and it's just reactive. And it gets to the point where it's too late almost.
It's not even on the radar. So, where do I turn? And for a lot of men, so we're already not good at asking for help. So the question becomes, where do I turn? Where does help exist?
Yeah, and so, as I mentioned with our guest earlier, there is that stigma, particularly in the Black community, that what, happens at home, stays at home, don't talk about it, we keep our stuff to ourselves, but obviously that is not helping, that doesn't help anybody.
Right.
So what can we continue to do to try to break down those barriers and those stigmas so that mental health doesn't seem, like such an obscure and crazy thing to talk about?
So one of the things that I believe in is doing what we're doing right now, and that's normalizing the conversation. So there is no community that you're going to live in, there is no car that you're going to drive. I don't care how big your house is, how much money you have, we all have stuff. So we all have issues, we all have challenges. And so to be able to talk about those, that's a big thing for a lot of people. How do I say I need help? How do I say that the thing that I'm going through is something that I can't handle? In terms of educating just people in general, but black men in particular, how do I know that the problem that I'm experiencing is more than just life coming at me sideways?
So what would you suggest for, not just black men, but anyone who is having these thoughts of suicide and contemplating it, and they don't know who to turn to? Who would you suggest that they release and vent to?
Right. So let's start with a place that we know. So we know church, right? So it's not a place where they necessarily provide mental health care, but it's a place where you can find support, emotional support, spiritual support. And I think one of the greatest gifts that the church gives us is hope. Hope that this situation possibly can get better. Church, then there's mental health treatment, right? So knowing where you can go, who you can talk to, and of course I have numbers and just places that people can call. The new number is 988. Having, like I say, social supports, having people to talk to, even if it's a friend. Now, here's the thing. So a lot of people think that, well, I'm not trained in mental health. I'm not equipped to talk to somebody who's, potentially suicidal. Wow, there is such value in just being able to say, I'm here.
Yep, absolutely.
And even as a clinical psychologist, what I understand is I don't have the power to fix your problem, but I'll travel that journey with you.
Absolutely. The power of presence is extremely powerful. Yeah, yeah. All right. And I know there was a situation several years ago where I got a phone call. It was in a different newsroom, but someone said that they were contemplating taking their life. And I just stayed on the phone with them. After what I experienced with my dad, I said, if I can prevent anybody, from having this situation overcome them and then their families. But like you said, I'm not trained as a therapist or a psychologist, but sometimes people just need to be heard and to be listened to.
One of the things that I try to stay away from is giving people cliches. Hang in there.
Yeah.
It's going to be all right. Actually, I don't know that it's going to be all right. I don't know that that situation is going to get better. For a lot of people, for example, they have financial problems, they have legal problems. I can't say that those are life problems. I can't say that those problems are going to go away. If your wife has left you, I can't promise you that she's coming back, right?
But you can give them some hope.
I can give them some hope, and then I can be there to listen.
Absolutely. Well, Dr. Doss, our time has run out. I know it just feels like we could just keep going on and on. We can continue the conversation off here, but thank you so very much for joining us. I really appreciate it. You can find the book, Good Soldiers Suffer in Silence, PTSD, Suicide, and Other Stuff Soldiers Don't Talk About on Amazon or on his website at richarddoss.com. And you can find more information on the important work he does with our nation's heroes at workingwithveterans.com.